Hello, everyone. Welcome back to the show. I'm April Rain, and tonight marks our final episode of Healthcare Voters web series, What's at Stake, where we've been exploring the pressing healthcare questions on your minds right now. In episode 4, we heard from families across the country about what's at stake for their healthcare in the context of the Supreme Court's upcoming consideration of the Affordable Care Act, or ACA. Today, we're hearing from experts and advocates about the newest pre-existing condition in America, surviving COVID-19, and what this means for accessing quality, affordable healthcare. Just 2 days ago, President Trump forced through the illegitimate confirmation of Amy Coney Barrett to the Supreme Court in his last-ditch effort to repeal the Affordable Care Act and strip healthcare from millions of families during this pandemic. Last week, he literally said he hopes the Supreme Court dismantles our healthcare. That's right. The President of the United States is actively stacking the Supreme Court with political appointees who have promised to do his bidding and repeal our healthcare in the middle of a pandemic. That's why tonight we're getting answers from experts to some of the most pressing questions you all have been asking. Is surviving COVID-19 a pre-existing condition? Will this impact my coverage? We'll talk about insurance companies, protections for people with pre-existing conditions under the ACA, and where we go from here. While we're talking tonight, we encourage you to share what's at stake for you and your families by going to healthcarevoter.org/story. That's healthcarevoter.org/story. Please like and share this live stream to spread the word to your family and friends. I am excited to introduce you all to our speakers today for this episode of What's at Stake. We have Maura Kousen, Managing Director of Health Policy Center for American Progress Action Fund. Dr. Ali Bokhari, the National President of the American Medical Student Association. Dr. Joya Krier-Perry, Special Advisor to We Must Count and President and Founder of the National Birth Equity Collaborative. Kristen Urquiza, the founder of Marked by COVID. Fiona Tulip, also from Marked by COVID. And Dr. Magdala Sherry, the coalition member for Just Democracy and the founder of the Not Just a Black Body campaign. For our first segment called Our Healthcare Stories, we're going to hear from Kristen, Fiona, and Dr. Sherry. Thank you all for joining us tonight. I'm going to start with my favorite question, as I do all the time for our guests, and I'm going to go to you, Kristen, first. Why are you a healthcare voter?
Thanks for having me on the show, and it's so great to meet you, April, and wonderful to be here with the other esteemed panelists. I'm a healthcare voter because we are in the biggest public health crisis of our lifetimes. We have already had more than 8 million people contract this virus, and we will have many more yet that will contract it. This is not just about COVID, but it's also the landscape of other long-term health impacts that this virus will have on our lives. I know I, for one, every single day struggle thinking not only about my own personal loss, but worrying about worrying about my mental health, worrying about my emotional health, and know that in order to be able to be a productive member of society, I will need to have access to quality care for the rest of my life. And I believe that's not a privilege. I think that's a right.
Absolutely, I agree with you. Healthcare, quality, affordable healthcare should be a right, not just a privilege for some. Fiona, I would like to go to you next and ask the same question. Why are you a healthcare voter?
Hi, April. Thank you so much for having me. That's my 1-year-old in the background, and that's a big reason why I'm a healthcare voter. So I'm a healthcare voter because I firmly believe in, like Kristen said, that it should be a right to be protected no matter what. My mom worked in the healthcare industry, and she went in every day bravely living in a constant state of fear, fear of transmitting the virus, fear of getting the virus, fear of the unknown. And she deserves to be here today, but because of that brave fight, because of her spending her life saving others, I feel like we should be doing everything to protect them and save them and to save each other. So, when with these, with ACA, ACA, I do believe that we deserve this. It's our right to be protected no matter what. I'm also a healthcare voter because my dad recently contracted the virus and he is fighting it right now. And I do think about him. He has pre-existing conditions and now COVID is going to be another one. And I just worry about protecting him and making sure that, he is taken care of for the rest of his life.
Absolutely. Fiona, we are so sorry that you've lost your mother this year. May her memory be a blessing. And we stand with you as your father continues to fight this insipid virus and hope he recovers fully.
Thank you.
Dr. Sherry, I'd like to come to you with the same question. Why are you a healthcare voter?
Thank you, April, and thank you for having me this evening. And Fiona, my heart is with you as a person who's lost both her parents to coronavirus during this pandemic. I fully understand what you are going through. And I'm a healthcare voter because it is absolutely necessary for us to turn around in this country is to understand the value of healthcare. We often are talking about the economy and jobs, but quite frankly, if people don't have health, they don't really have anything. It's one of the biggest ways of wealth. If we're transparent, it's not just about having a job, but can we go to work? Are we healthy enough to be at work? And what happens when chronic diseases are happening, or even mental health, which is going to be the next crisis, like it or not, after this pandemic with everything we faced in 2020. So this is on the ballot. This is real. I know before my father passed, the reason why he waited to get seen and cared for is because he had no insurance. And I often wonder in my mind, if he felt like he could trust the system, may he have been here now? Because maybe he would have went to the hospital a lot sooner. So yeah, this is near and dear to me. And this is the reason why people need to go out and vote.
Thank you for that. And I am so sorry. I cannot imagine losing not one, but two parents in the same year to this virus that is truly affecting everyone. Fiona, I'd like to come back to you. You've got a parent who is struggling with the virus and one who unfortunately succumbed to the virus. If you could speak directly to lawmakers like President Trump, Senator Ted Cruz, and Senator John Cornyn of Texas, what would you tell them about the way they've handled the pandemic?
There's so many things. I think about this all the time, and I want to tell them that there has been a real failure among the American people. And, they have, just divided our country and they have mishandled this virus gravely. And this should never have happened. We should never have been in this situation. They should have protected us. And they had so many opportunities to protect us. They had so many opportunities to lead, and they chose not to. So I would let them know that this was a huge failure and a huge fiasco, and it was preventable. And it was because of them that this many lives have been lost. And it's because of them that my mom is not here to call my daughter.
Absolutely. Dr. Sherry, you launched a platform called #NotJustABlackBody, dedicated to honoring the Black lives that were cut short from the injustices and racism surrounding COVID-19, including your own parents, unfortunately. Can you tell our viewers about why you created the platform and how they can support it?
Absolutely. So the platform was created and just thinking about my father's experience. So just to give everyone context, I'm a medical provider myself, internal medicine. And like I said, my father didn't necessarily tell me initially when he had symptoms. He was the caregiver to my sick mother, was thinking about the bills, thinking about not being able to leave her. We were separating ourselves and quarantining ourselves just to protect everyone. And I had to literally beg him to go to the hospital because he was so nervous about what the bill would look like, who would pay for it, and the aftermath. And I remember I went to a safety net hospital. I remember being in the ER with my father and being utterly shocked by what I saw. Shocked by the amount of people of color who were in there. And if you remember early on in the pandemic, there were rumors going around that Black people couldn't get the virus, and a lot of people didn't believe it was actually existing in our communities. We were not being transparent. There was no racial data up until into April, so we didn't know what was happening in New Orleans, in Detroit, in Baltimore, and there wasn't transparency. So a lot of people were not aware of what was happening. And let's be honest, the Black and minority and communities of color don't trust the healthcare system, right? So, and I saw that firsthand with my father. I tried to stay, they wouldn't let me stay. I could barely get updates. Luckily for me, I was able to drop off an iPhone, so he would call me and be able to lift up his phone so I could see what was happening. And quite frankly, he kept saying, "Can you get me out of here? I feel like they just see me as a Black body and I don't matter to them. I don't have value. And I just don't feel like anyone cares." And ultimately, he was not monitored properly because he was never on a ventilator, but they didn't have him monitored properly. He didn't have his oxygen and essentially suffocated to death because he wasn't monitored properly and didn't get to him in time. So when this all happened, and I had friends who were telling me stories of their family members being turned away from the ER, saying that their symptoms are not COVID related, not going to the hospital, not hearing from them for days, and then getting a phone call saying, "I'm sorry for your loss." And you're like, what happened between the last few days? And so in my community, hearing the stories that were not told on TV, that were not being translated, and almost every person being a person of color, I decided to start this platform to elevate their voices. And in the early parts of the pandemic, we were putting out articles and just having people aware, doing webinars saying, no, it does impact the people of color. And actually, as a minority, for a system that is not preparing us and our hospitals, you need to be careful, because there's a likelihood if you go, the outcome will not be favorable. So with our platform, we were sharing information. We were doing webinars to let people know what symptoms to be prepared for, what to ask when they go to the doctor, and how to advocate for themselves. And moving forward, we're continuing to work on a podcast to elevate stories. So we invite people to go to our website and to our Instagram, Not Just a Black Body, to submit their stories, pictures, so we can elevate their family stories, and then use those stories to say, how do we change the healthcare system? It's not just getting through COVID and getting through this facet, but we have to learn something, because what this pandemic did is really put a magnifying glass to cracks we already had, even before the virus came and did what it did to our communities.
That's absolutely right. And we know the statistics show, the data is out there that shows that Black and brown people are not treated the same within the healthcare system. And unfortunately, you have a very sad story to tell with that personal experience. And we're sorry for that. Kristen, you also launched a platform called Marked by COVID to hold elected officials accountable for their pandemic response or lack thereof. Can you tell our viewers about why you created your platform and how we can support it?
Absolutely. I mean, similar to the stories we just heard, I lost my dad to COVID on June 30th and launched the platform Marked by COVID on July 8th, the day that I buried my father. My dad became ill with COVID symptoms on June 11th. That weekend, there were people in my childhood neighborhood where he still lived that were waiting 13 hours in line for just a test while they had COVID symptoms. This was the summer in Arizona, where there were no bathrooms, no air conditioning, no water. People were sick and waiting in the 106-degree sun to get a test. I raise this because my neighborhood, where I grew up, where my dad lived, where my mother still lives, where I'm talking to you from right now, is 70% Latino, mostly immigrant, folks who are living at the poverty line, the people who did not have the extreme privilege to Netflix and chill during the shutdown, but are the essential workers who are in the pharmacies, in the grocery stores, out in the fields, on the front lines, and predominantly Latino, Black, Indigenous, and other people of color. When my father passed, I wrote an impassioned obituary, which squarely put the blame of his passing, not just on COVID, but the politicization of the virus, the fact that politicians were basically casting away Black and brown bodies in order to try and force open the economy at our expense. So it, for me too, was very much about the disparities. It was about the fact that our communities are expendable to this administration. And for me, I was just ready to say enough is enough, because these people, our family members, our loved ones, they're not expendable or replaceable. They are essential to our communities and essential to our well-being and our hearts. And so Marked by COVID was born, and shortly thereafter, we started connecting with folks like Fiona and others who have experienced this loss and have been mobilizing to uplift stories, as well as to hold politicians accountable and demand a coordinated, data-driven national response to this pandemic so that we can save lives and get our economy back on track.
And tell us how we can support Marked by COVID.
So we have a website, markedbycovid.com. Definitely check that out. There is an option for donation if you have the means to help support the work. We also have platforms on Instagram, Twitter, and Facebook at Marked by COVID. Please follow us, share stories that you see there, because it all matters that we continue to lift our voices and really show the human impacts of the lies and deceit from this COVID response.
That's right, Kristen, and we send our condolences to you for the loss of your father. You know, it's one thing to hear it on the news and read the articles about it, but it's another to actually, it's a different thing altogether to hear someone, talk about losing a loved one or a parent so very recently. Kristen, I would love to talk to you because there's a lot of misinformation being spread online, including by the administration. I mean, right now, we've even seen folks and trolls sharing misinformation in the comments on this live stream right now. What is one thing you think everyone should know about this pandemic?
Whew, that's a good one. Well, to continue to bolster your point, I mean, we have the evidence that over 30% of the misinformation comes from the White House itself. The one thing that I think people need to embrace more than anything else is that this is real and it's absolutely stoppable if we just commit ourselves to a few simple, inexpensive, and completely accessible treatments, like a little bit of distancing physically, wearing a mask, and limiting our interactions to just necessary visits. We're so lucky in a way that this isn't in our water system or something worse. We have the opportunity, we have the means to stop this, and we need everyone to pitch in. It's absolutely the most patriotic thing that any one of us can be doing right now, is to protect one another through these simple, effective, and accessible public health measures.
I think that's a great point, that we need to get back to community. You know, I am my brother's keeper. I am my sister's keeper. Fiona, I'd love to ask you the same question. And then Dr. Sherry, I'm going to come to you. Fiona, what is one thing that you think everyone should know about this pandemic?
I think they should know that it is real and it's not going to go away on November 4th, and that we just need to listen to the science. It is here. I lost my mother. My father has it. It's affecting our loved ones. And I was talking about this earlier today with my grief counselor and saying, I just don't understand, if it's not so much about, protecting yourself, but if you can save someone else by wearing a mask, why can't you just do it? It could save someone's grandmother. It could save someone's sister, someone's brother, someone's dad, just by wearing a mask. And it's not me versus you. It's us versus the virus. And that's what I want everyone to know. It's us versus the virus. So if we come together and really fight this thing together, we'll be able to save lives. And that should be something we should all want to do, to save a life. And that's really my main message. Wear a mask, wash your hands, socially distant, stay home, but really just think about other people and save a life.
Absolutely. And that's part of what needs to be done, right? Reframing this conversation that we're having and making it personal for folks. Dr. Sherry, what would you say? What is one thing you think everyone should know about this pandemic?
We're all at risk. I think one of the biggest misconceptions or things that is misleading is this idea that I'm not in that high risk group. I don't have a chronic condition. I'm not really old. My father wasn't that old either. He was 60, but other than that, never been hospitalized. No pre-existing condition. Doesn't take any medication. I mean, if anything, I thought he was rock solid. And I said, I wanted him to be careful so he wouldn't bring it to mom because mom had chronic conditions. And one of the realest things I saw was to watch my father belly breathing and struggling to breathe. And I make it a point to say that because I know we've seen the president who has made it seem like it's because he's strong, he's been able to fight it. My father was one of the strongest people I know. He could hide pain like no one's business. And when I watched him struggling to breathe and having to coach him through each breath and watching him in the hospital, I was like, this is real. And everyone is at risk. So I can't reiterate enough. Do not think you're protected and because you're young or you don't take any medications or there's nothing, your risk is really low. No. Everyone has the potential to die from this. We've seen the numbers. It's hitting everyone from every gamut. And if you just understand that for yourself, you can only imagine how protecting yourself also protects your community and those around you.
That's right. This virus doesn't care.
Nope.
Old, young, stable, unstable, comorbidities or not, it is wreaking havoc throughout this country and in fact, throughout the world. Dr. Sherry, I'd like to stick with you and go back to a point you made about how hospitals are full of Black and brown people. And it's clear this pandemic has exposed the racial inequities once again in our society and our healthcare system. What do you think our elected officials can do to bridge this divide and restore trust?
Absolutely. And I'm going to make it a point again. This COVID did not cause these disparities. These disparities existed beforehand. And what has been done and what you can trace back to in the early parts of this pandemic, when we started discussing the disparities and the gaps and the differences, the first thing we did is play the blame game to the Black community and to Hispanic and colored communities. We said, well, it makes sense. They have higher rates of diabetes, hypertension, and other conditions. Well, if that makes sense, those are the communities that should have been best prepared. Right? Those are the communities that should have had all the PPE. Those are the communities that back in January, when we knew this was coming, we say the most vulnerable of us is going to be the most impacted. So that is where we start with our resources. So let's be honest. We have to talk about these things. We can't just say, oh, we expected it to happen. They thought we were worth dying for. That's what happened. They felt that our communities weren't valuable enough to help us fight this. So when we think about a post-COVID or post-pandemic world, politicians need to come in and start making sure proper resources are allocated. Because if it's not this, the next pandemic, mental health crisis, whatever it's going to be, is going to impact our communities even more. So we need to make sure that they're thinking about us when they're making these policies, when they're making these laws, and don't just blame us. Let's talk about the determinants of health and the political determinants that make our communities at higher risk. Do we have housing stability? Do we have food security? All these things that play a part into our health, right? So it's all about the infrastructure. This is not new. We just have a huge lens on what's happening and what's been happening in our healthcare system.
That's right. I mean, the healthcare system, it has ripple effects, right? It's not just in a silo by itself. It literally affects every single part of our life. Fiona, I'd like to come back to you. A big part of raising awareness about the COVID's true devastation is having tough conversations, often with people who don't believe the pandemic is happening. Can you tell us about how you've approached these conversations?
I've approached them with science and facts, and I've had these tough conversations with family members, family members who have lost my mom as well, and it's been confusing to me. I had a cousin who, even after my mom died, still claimed that it was a hoax and that it would go away. And it broke my heart.
Family member, I'm sorry to interrupt you, but I'm having trouble putting it together. A family member who knew your mother and who knew that she had passed away still didn't believe that it had happened.
Exactly. Yeah. And he even went to my mom's funeral with COVID. So I don't understand. And my mom loved him and gave him so much attention, and they were close. And so even after she died, he said the virus would go away. He also claimed that it was like she likely died because she wore a mask all day and she was breathing in toxins. And he's a biology major. And so I was very confused. And so I came back with facts and I came back with science. And that's how I've approached most people. I've had people find me on Instagram and Facebook and just say, you're lying and it's not real, and, prove that your mom's dead and let me see the obituary. And it's tough. It's tough to go through losing a mother. And then it's tough to have to, I guess, fight people to convince them that she really did die of COVID. And I can't say that I've changed anyone's mind, but I think what's really missing here is science.
Absolutely. And I want to thank all three of you. I want to keep talking, but I just want to thank you for your strength. You are dealing with the loss of a parent, you are grieving, and yet you have to deal with a lot of ignorance, sometimes within your own family, as you're trying to help other people. So I just applaud your ability to do this, especially right now. Dr. Sherry, I want to ask one more question. We got one that caught our attention on Facebook from Teresa, who said, my autistic son is a diabetic. How can I protect him other than wearing a mask?
The biggest thing for those who have conditions that put them at risk is keeping those conditions under control. So you want to make sure, if you have hypertension, diabetes, other issues, you want to make sure those things remain controlled and that they're in the ideal range. So keeping up with doctor's visits, making sure if anything happens, if there's any symptoms that they may be sick, which could be even the flu, because we're heading into flu season, make sure that's in check. I would recommend flu vaccine. So the best you can do for anyone, especially those who have conditions that put them at risk, is making sure those are controlled and that you're taking your appropriate medications. And then again, just making sure you're practicing the public health protocols, social distance, wearing a mask. And if there's someone, even if they're a friend, they're not typically following the guidelines, limit your interactions. I mean, go to Zoom or do something electronic, because it's just not worth it.
I think that's right. Tough love in this situation could literally save your life or the life of someone that you care about who's not doing everything that they can. Linda on Facebook says over 224,000 people have died, and now we get the second wave on top of flu season, as Dr. Sherry just mentioned. Please vote, Linda says, for your own and others' lives. And before we go to the next segment, I'd like to come back to Kristen and truly ask all of you, do you have anything else that you'd like to share with our audience?
Just in closing, I think that to uplift what you just said, April, about the importance of voting this election cycle, something that I've been saying to folks along the way is that it's often that we don't feel like our voice matters or that our position is important. But the thing that I've been saying to voters is that your voice matters to me. So please show up to the polls and help us get to the other side of this pandemic together.
I love that. And I hope making it personal that way does make a difference. Dr. Sherry, what would you say? Is there anything else you'd like to share with the audience as we close?
Just continue to listen to the data And I think we've all said it here, the science. Understand that unfortunately some people are using this pandemic as a political agenda, but as everyone has said on this call, we've felt this. We've experienced this. We've seen loss. It's painful. We don't want other families to feel this. So on behalf of just caring for your family and those around you, take this seriously and vote. Vote is how you keep your leaders accountable. It's how you uphold them to the responsibility they take when they say that they are fighting for us. You can't necessarily complain if you don't put your vote and your voice in the ring. So make sure you vote.
Absolutely. Voting is so important. And remember, November 3rd is the last day to vote. It's not the only day to vote. So if you can get out there early, especially now, don't mail in your ballots at this point because it may be too late. Put them in a drop box yourself, but also if you can, stand in line and early vote. And the last word goes to you, Fiona. Is there anything else you'd like to share with the audience today as we close?
Yes, I would. I want people to know that this crisis, the one where my family must stay apart to do our part, even when we most want to be together, is more than just death rates and death count. And there are people behind those numbers. There are lives and there are stories. That is my mom, and that's Kristen's father, and that's Dr. Sherry's parents. And there are stories and feelings and heart behind those numbers. So I beg you to put pressure on our leadership to do better and to vote for leadership who will care about those lives and not just count them as numbers. The people who can help us are Congress, the governors, and the president. We are crying out for help, and they can help us, and they are not right now. So please remember that if we do not make change and if we do not go out and vote, these numbers will continue to rise and people will continue to lose loved ones when we don't have to.
Thank you for that. I want to thank you, Kristen, Fiona, and Dr. Sherry for your transparency, for your vulnerability today, and for joining us, and to reiterate our commitment to fighting alongside all of you to protect access to quality health care. Thank you to everyone who's tuning in today to this important conversation. Please like and share the live stream, and we welcome questions for our speakers in the comments. And I want to take a moment just to share a couple of stories we've received from viewers on Facebook. Rachel says, the ACA saved my life. Just changing the pre-existing conditions protection saved me. And that's so powerful. Just one provision of the ACA literally saved Rachel's life. And Jamie says, as a healthcare worker, it's difficult. I don't get the care I need because of the expensive copays, deductibles, and so on. Currently, I am making $150 a month payments on a broken foot for another 14 months. And as a result, I am shuffling bills. I worry daily as I am testing folks for COVID, even with PPE. And Jamie, it breaks my heart to hear that because you are a hero on the front lines of this pandemic and you're still experiencing this. Thank you for taking care of people, and we are working hard to change leadership and get you the care that you need. Thanks to Rachel and Jamie for sharing. To everyone tuning in now, we want to hear from you too. Please visit healthcarevoter.org/story to share your own healthcare story. And we're going to jump right into our next segment called What's at Stake with some experts who are eager to answer your questions about COVID. I'm excited to welcome Dr. Ali Bokhari, Maura Kelson, and Dr. Joya Creer-Perry to the show. Before we dive into everything, I want to ask you all the same question I always ask. I'm going to start with Dr. Bokhari. Why are you a healthcare voter?
Hi, April. Thank you so much for having us here today. I'm a healthcare voter for many of the same reasons of why I'm a doctor and why I went into medicine. My parents immigrated over here to this country and they escaped from poverty and a lack of upward mobility. And we grew up with access to basic healthcare, with access to a free world-class public education. And as a result of that, and from the Affordable Care Act, we got to see some of those same services, access to care, being expanded and provided to more people. But now we've been seeing some threats and assaults to access to care even before this pandemic hit us. And that means that as providers, how are we supposed to care for our patients if our patients don't have the access to come see us? And this is now only just become even more exacerbated by the pandemic that we're seeing. So I'm a healthcare voter because health is important, not just for me and my family, but for our communities, and for our patients and for our country. And we'd like to be able to see that expanded and provided to all Americans.
Absolutely. Dr. Kriya-Perry, if I can come to you next, why are you a healthcare voter?
No, it's really important. And thank you so much, my friend April, for inviting me on this show. I am a healthcare voter because as an OBGYN, I was taught that health is an individual choice, that people are healthy because they make good decisions or they either have bad genetics and it's bad protoplasm. That's the kind of stuff you hear when you're training in medicine. And I always knew none of that really made much sense. As a person who studied sociology and economics and political theory, I recognized that health is not about individual genes or choices, but these structures, these policy choices, the policy violence that's been exacted upon Black people, upon Indigenous people, upon immigrants, upon women, has caused health inequity. So I vote around healthcare because healthcare is not individual responsibility or genetics. Healthcare is a policy choice.
Absolutely. Thank you for that. And I love that reframing. Maura, I'd love to come to you and ask my favorite question. Why are you a healthcare voter?
Well, I mean, how can you not be a healthcare voter right now? We are in the middle of a pandemic that has taken the lives of over 225,000 people. It has laid bare the structural inequities across our entire healthcare system. I mean, we just heard 3 of those devastating personal stories. And just as people have said when they've answered this question throughout the evening, I mean, healthcare is a fundamental right. But today, in the United States, in the middle of this absolutely devastating pandemic, there is an entire political party that treats this fundamental right as merely a privilege for the fortunate, and they're working to rip coverage away from millions of people. And I'd say, in addition to just that protection piece, I'm also a healthcare voter because we have to achieve universal coverage. We need to make sure that people get access to preventive care. When they get sick, they can get that coverage and they will not suffer financially. And beyond coverage, I'm a healthcare voter because we absolutely have to confront finally the systemic racism that leads to the nation's health inequities.
100%. I agree on every single point. And Maura, I'd love to stay with you and ask, how do you expect health insurance companies, how will they treat COVID survivors when gauging their coverage eligibility? And how would the repeal of the Affordable Care Act impact that?
That's the main issue. The world we're in now, thanks to the ACA, insurance companies cannot deny coverage to COVID survivors or charge them more, just like they cannot do so with other people with pre-existing conditions and disabilities. And more importantly than just the coverage and the pricing, COVID survivors know that they'll have coverage for the drugs that they need, the services that they need, the mental health care that they're going to need. And repeal of the ACA completely upends all of those protections. We have over 8 million people right now who are COVID survivors. That number is going to be rapidly increasing. Over the past week, we have 7,100, 500 people on average who become sick. Every single one of those people who are lucky enough to survive the disease are going to be facing potential discrimination if the ACA is once again turned down. I think the other piece of the ACA that I think we really need to talk about is insurers before the ACA could impose really terrible draconian annual and lifetime limits. And that is not allowed now. And what really makes those provisions particularly important, I think, in this context is we have so much that we don't know about this virus right now. We know that it has long-lasting effects on the health of the survivors. I mean, the list includes potential permanent lung and heart damage, more prone to strokes, seizures, Parkinson's disease, Alzheimer's, blood clots. I mean, the list goes on. And what is really concerning is that people who have only had mild symptoms or who were young and healthy could have these long-term results. So I think that the focus on, all of the pre-existing condition protections are really critical, but I do think that the protection against lifetime and annual limits is something that I just haven't heard enough people talk about in the context of the COVID pandemic.
I think that's absolutely right, because we just don't know what this virus is going to do to our bodies. And it seems like there's so many people who are experiencing it in different ways. I've seen people who say, I have glaucoma now, I just had gallbladder surgery. And these aren't necessarily things, when some people talk about COVID, it's just about respiration. And so you figure, if you can breathe well again and get walking in the park, then you're fine. But we just don't know. And that's the concern. Dr. Bokhari, how can the future generation of healthcare leaders prevent a crisis of this scale and scope from happening again?
Sure. One of the most devastating parts about this pandemic is that we know how to manage it. We've done it before. For me personally, I studied public health, and we had to take this class called the Public Health Crisis Survival Guide. And it lays out, some basic steps that some of us would just laugh at. It's like step one, make sure that you put together a team and set up some roles. Step two, make sure you provide open and clear, honest communication. And some of the very fundamentals, unfortunately, have not taken place and have just been completely mismanaged. So not only does this offer us a learning experience to be able to apply to any future crises that happen, but we always have had the correct set of steps to be able to manage crises from past crises that we've had, and we can learn from them and apply it to crises going forward.
I'd like to talk to all of you on this particular question, and I'm going to start with you, Dr. Krier-Perry. Marginalized communities already face disparities in access to care, as you mentioned. How will this pandemic impact how insurance companies, healthcare providers, and everyone treat people of marginalized identities?
Man, we are so hopeful. I'm an optimist. So I'm going to tell you what I hope it does, that I have no evidence for. I hope that it allows for us to see insurance companies. I hope it allows for governments to see that choosing capitalism as a public health response was never going to work. That in order for us to have a true public health response, we have to invest really in the people who are the most impacted. So that means you might not make a big profit on that. That health is not something that we should want profits from. That health is something that we should want people to have justice and joy from, that we should invest in. So the people who are the most impacted might not be able to pay you cash for the vaccine or pay top dollar for their PPE, but they're actually fixing the food for the people who can pay cash, and they're changing the beds in the hospitals for the folks who have that money. So perhaps you should invest in their care, invest in ensuring that they can thrive and survive. So I am optimistic that although I have worked with a lot of insurance companies over the years, and their bottom line in general is usually what is actuarially sound, and the reason we can't invest in pre-existing illnesses is because those people are sicker. Well, of course they're sicker. And so your job is to make sure that they have the care that they need. So I'm hopeful and optimistic that COVID-19 has placed us all on the same level playing field. Rich people, poor people, everybody, we're all getting sick, and marginalized communities are taking care of you. And if you don't protect them, you will be sick as well.
That's right. Maura, can I ask you the same question? How do you think that insurance companies, the healthcare providers, are going to be impacted and treat people of marginalized identities because of the pandemic?
Well, I think that I agree completely with Dr. Perry. I think that I wouldn't say I'm quite as optimistic, but I'm hopeful that this really is a teaching and learning moment for the healthcare system. That we have done, not just in the response to COVID and what's gone on in the past 8 months, but really a reckoning with the fact that there are just so many overlapping pieces of our legacy, having systemic racism at every level of our communities. And, there is a reason why Black Americans have such higher rates of diabetes, and in certain areas, obesity and hypertension, and really thinking, hopefully it will carry the conversation forward to really make this one not just about acute care, but really trying to address the upstream issues that really have exacerbated just this terrible last 8 months.
Absolutely agree. And Dr. Bakari, I'm going to come to you next. I just want to share a comment that we got from Judy on Facebook. She says, "Thank you for invigorating my desire to fight for healthcare for all." Judy, we're so glad to hear you're feeling fired up and ready to go to fight for healthcare for all of us. And folks, I'd like to know what invigorates you in your fight for quality healthcare for everyone. Dr. Bakari, can I start with you?
Sure. I think it goes back to some of the fundamentals of how we define health, right? When you take a definition of health, and especially using the WHO definition, that's not just the absence of disease or infirmity, it's the overall social and mental well-being. And from that, what that means is healthcare is not just what we might view it in traditional sense or how we might view it right now in the middle of this pandemic, but it has intersections with environmental policy, with domestic policy, economic policy, and as this pandemic also shows, foreign policy. So health is everything. And so keeping that in mind, we think about whether at the micro level, when you're dealing with a patient, when it comes down to primary care and preventive medicine to try to make sure we have a healthier population. And then also at the macro level, thinking about all these other different types of policy areas that ultimately will impact the health of Americans.
And I really think that's the through thread tonight, right? That it's not just healthcare, that it truly affects every other policy situation that we can think of. Dr. Kriya Perry, I'd like to come back to you. What motivates you and invigorates you in your fight for quality healthcare for all?
Well, I believe we're so close. I think that we as a nation, we're the only high income nation in the world that doesn't believe that health is a right. We get stuck in the how. We argue about, should it be single payer? Should it be a mixture of this and that? But we haven't ever agreed that we believe all people, regardless of race, gender, age, geographics, deserve health, right? Not just a health insurance card, but do we believe as a country that every person deserves to be healthy? And every other country that has as much money as we do says yes to that. We keep arguing about that. We keep dismantling that. We keep saying, well, you deserve it if you go to work, or you deserve it if you're doing your part, or bootstrapping. But the evidence shows us, especially, I'll give you the example of, during the We Must Count work that we're doing, we're just asking for disaggregated data by race and trying to see like where Black people were dying and where brown people were dying and what's happening in Indigenous communities. Some of the pushback around why we couldn't get the data by race is when they got the preliminary data, they saw it was happening in Black and brown communities. And they knew, oh Lord, if we say this out loud, we're gonna have to change how we allocate resources, right? And so what gives me hope is that now that we see you're hiding stuff just so you don't have to actually invest in communities, you're wanting to skip over CDC, want to skip over agencies just so you don't have to actually do the work to protect us all. And it's killing everybody. It's killing rural white folks. It's killing Black folks. Like, this is not helpful for anybody. So what invigorates me is that we now have the information. We have the knowledge to know that racism is only harming all of us. This idea that only certain people should have and we can't afford care for everyone, that was never a truth. We can't afford it. We must afford it. It's a part of our national security. If we don't secure the health of our citizens and people who are in this nation, then we're not being secure as a nation for the world. We're not showing our American exceptionalism. So it gives me hope that we believe in American exceptionalism means investing in every person.
I love that. And I'm definitely not a doctor, but I do know that wounds need oxygen to heal. And so when we keep these things buried down and we don't have these important conversations, there's no way that we can get past them because the issues continue to fester. That's my metaphor for the day. That's as far as I go.
We need some truth and some light and some antiseptic, right?
Yeah. Maura, I'd like to come to you and ask the same question. What keeps you motivated and energized in this fight?
I would say I have both positive and negative energy for this fight. I mean, first of all, nothing is more fundamental to your happiness, your ability to live the life you want to live as your healthcare. Some people are born, with luck, but you know what? Even the luckiest, healthiest person at some point is going to need to go to a doctor, is going to need to receive great care. And it is just morally reprehensible that not everybody in this country has it. So I just think that fight to make sure that everybody has the access to healthcare that I have been lucky to have for my whole life if that is my underlying motivation. Right now, I am also just very angry, and that fuels me day to day right now. I cannot believe that we are existing in this country right now. We are having an argument about taking away coverage from 20 million people in the middle of a pandemic that has claimed the life of over 227 people. It just makes me ragey. And that, depending on the day or the moment, I either think big thoughts on how we can build this structure where everybody can have really the benefits that I've been really lucky to have my whole life. And then at the same time, I just really want to fight to make sure that those who think it's a privilege don't win in the end.
Absolutely. I'm here for rage as a motivating factor. And I'd like to stay with you for just a second, but ask this question to all of you. Maura first, what are some of the key questions about coverage for COVID survivors that lawmakers aren't answering for Americans?
I'm going to put aside, there's a huge question of what happens if the ACA is repealed. And I think that that's just totally another topic for another time. And it's, but I think that there are, changes, and it's coverage and also how much payment and cost. So in terms of what types of covered benefits you have, how are you going to make sure that survivors can actually get those medicines? If they're, for example, we were talking about all the different long-term effects that COVID survivors have. How do you make sure that the person who was diabetic who survived can afford both their insulin and what other treatments might come down the road to help them alleviate some of the long-term symptoms that they may have in a couple of years? How are we going to not only reduce the price of drugs, but how are we going to make sure that people can actually afford those prices, even if they come down? The need for mental health care has been mentioned many, many times on this call. There are professional mental health care shortages across the country, especially in a lot of rural areas. It's a real problem for people on Medicaid, for example, being able to access those services. So what concrete steps are you lawmakers going to do to make sure that we bolster the supply of mental health professionals, and then make sure that people who need these services, and people need them like never before, are actually able to access them? And then I think the next question, I'm sorry.
No, please come.
I would end kind of more broadly. And I think, it's this idea that we've talked about on this panel about awakening, really hold lawmakers' feet to the fire. And, what are you going to do to address these disparities? When we're talking about healthcare, we're talking about COVID survivors. What are we going to do to make sure that they have housing security? What are we going to do to make sure they have food security? And really treat people as a whole person rather than just a person who cycled in and out of the medical system.
I think that's exactly right. Thank you for adding that point. Dr. Bakari, I'd like to ask you the same question. What are some of the key questions about coverage for COVID survivors that lawmakers aren't answering for Americans?
I completely agree with Maura, and I think she covered it pretty well. One thing I'll just piggyback on a little bit has been the question of underinsurance. Even before this pandemic, we were dealing with a huge portion of the population not having adequate benefits or coverage, even though they were insured. And even though through the pandemic, then you have public health emergency guidelines being put in place as we phase out of this, we have to revisit that question and think about the larger picture of how once the ACA was passed, we would have to build upon it. It's unfortunate that we're facing a crisis where some of the pillars of the ACA have been attacked, and leading up to the question of the Supreme Court case. But now is an opportunity for us to tackle the underinsurance question and make progress towards achieving universal health care.
You're absolutely right. We're definitely not talking about the underinsured enough. Dr. Krier-Perry, how can COVID survivors mobilize over the next few weeks to make sure that they too have access to quality, affordable health care?
I have many colleagues and friends, especially as a healthcare provider, as a physician, who have become ill, and they have chronic conditions. And so really, we are part of a movement now of people who are going to have chronic conditions who need support around work hours, They're going to need support around chronic fatigue. So this idea really of creating a community of COVID survivors is important because it's almost like 9/11, the 9/11 survivors. I'm a Katrina survivor. Like when you've survived a big trauma, we don't know what the long-term impact. We know the long-term impact of Katrina has been that there are many children who are still dealing with the trauma that we never addressed in New Orleans, right? And so that's the same kind of thing that we need our COVID survivors to do, to really organize and to come together so that we can account for their long-term illnesses, the long-term impact on their ability to be productive. Because if we only value people in the United States if they can produce, and you have now had an illness that you were not protected by because your government failed you, then you're owed the ability to be sure that you are safe and you're well and that you're able to live a long life. And so coming together as a community and really fighting for what you're owed because you were failed by your government is important.
I love that. I love saying that they are owed and there should be some accountability. We only have a couple of minutes left. Natalie on Facebook asked, how can the Affordable Care Act repeal Supreme Court decision be undone if it happens? And what would it go in effect on people's Affordable Care Act insurance and Medicaid? Maura, can I come to you first with that?
Yes, it's a great question, and it is an extraordinarily complicated question because there are different outcomes that the Supreme Court could find that the entire law is constitutional. It could find that the entire law is unconstitutional, or it could find that portions of the law are unconstitutional. So what stays and what goes very much depends on that analysis. What is so problematic about this, and what I really hope that the justices think about, is the real world implications of repealing even a little bitty part of the law, because it would completely throw the healthcare system into massive chaos. I mean, there's never a good time to repeal the ACA, but this would be, the absolute most catastrophic time. I mean, everybody from young adults who would have to find new coverage at the same time as young adults are being disproportionately impacted by economically because of the pandemic, to older Americans who will see higher drug prices because of the donut hole, to people with employer-based insurance who might see lifetime and annual limits again. So unfortunately, I don't have a great answer because it would be so catastrophic. I think if that happened and we had and we were able to have leaders in Congress and a president committed to rebuilding it, we could absolutely do that. But I mean, that is starting from scratch, and really you would be digging out from such chaos. And that's really the message that we've been really trying to say. Like, you never, ever, ever want to repeal and upend the healthcare system, but doing so right now is just would be morally reprehensible, cruel, and just throw the entire system into chaos. And we just have to really exert pressure because, the Supreme Court is still 9 people, and people can have pressure. They can understand the real life consequences of their decisions. They can be influenced by people that they hear on TV talking about the risks that we'll face. So I think that's really helpful, regardless of what happens with the election, to keep telling stories about what the Affordable Care Act means to you and how devastating it would be.
Absolutely. Thank you so much for that. And I'm sorry that we are out of time because I have learned so much and I could listen to you all forever. But Dr. Joya Krier-Perry, Dr. Ali Bokhari, and Maura Kalson, thank you so much for your advocacy, for taking time to answer our questions, and for inspiring all of us. And thank you to all of our viewers for joining us today and throughout the series and sharing your stories. I learned so much from our guests and from our viewers in the comments. While today we heard from these inspiring panelists of speakers, we also still want to hear from you, the healthcare voters tuning in from all over America. Visit healthcarevoter.org/story to share your own story about how the Affordable Care Act has benefited you and your loved ones. With the election less than a week away and the subsequent arguments before the Supreme Court regarding the healthcare repeal lawsuit just days after, there's so much at stake for the health of our nation. Hosting this web series for the last couple of months and learning along with all of you about what's at stake for our healthcare in November has been so incredibly powerful for me. I hope you'll all join me in making our voices heard at the polls, mobilizing to protect our healthcare, and taking care of one another through this challenging time. Wear your mask, social distance, wash your hands. I'm proud to be a healthcare voter, and I'm proud to be fighting for a moral, dignified, and healthy America alongside all of you. Thank you for tuning into our web series, What's at Stake, and we'll be back with more sooner than you know.